ECG for the beginners, part 1, basics and principle of the ECG. Under this title, we will explain from basic up to advanced ECG. Now, in today's lecture, we will be discussing about the electrocardiogram. For short, they use ECG or EKG. Both of them are the same, these two acronyms. ECG and EKG acronyms. Later on, I will discuss about these two acronyms, what they stand for or where they come from. What they stand for and where they come from. Electrocardiogram. First, we should go, in addition to this topic, I mean electrocardiogram, I want to draw here a simple picture of the heart. That is why I draw the simple picture of the heart, because of two reasons. Because of two reasons. Reason number one. Because of two reasons. Reason number one. Due to electrical activity of this heart, first electrical force, electrical potential, electrical voltage, electrical discharge, electrical voltage. Remember, all of these terms are the same. They represent electrical force. Force, due to electrical activity of this heart, force, electrical force or electrical potential is produced. Then this electrical force or potential is presented by a vector. It must be presented by a vector. Why? Because in physics, every force is presented by a vector. When we are talking about the vector, you should think about the electrical force. Since this is a physics, in the physics, they presented by a vector. When you take the name of the vector in ECG, immediately you should think about the electrical potential. Electrical potential. Now this electrical potential from this heart or from that guide, that heart, this electrical force which is produced within these heart, this electrical force moves from inside of the heart to the outer part of the heart, I mean the skin surface. Then this electrical force is picked up by those electrodes which are attached here, and they take the electrical force, and then through this wire they transmit to the ECG machine. Then the ECG machine, and finally this electrical force reach to the needle of the ECG machine or stylus of the ECG machine. Then this electrical force lead to deflection of the ECG machine paper, deflection of the needle of the ECG or stylus of the ECG machine, and then this needle goes up and down and produce a typical form of ECG. P, the first wave is called P, the second wave is called Q, the third wave is called R, the fourth wave is S, and the fifth one is T, and the last one U, which is uncertain, the source of this U. So again, with the electrical activity of this heart force, electrical force or electrical potential or electrical voltage or electrical impulse or electrical current, remember all of these terms are the same, which represent electrical force. Then this electrical force should be presented by a vector. In physics, every force is presented by a vector. When we are talking about the vector, we should think about the electrical force. They are looking different, but they are giving the same meaning. Then this electrical force from this heart goes to the outer surface of the body. And then this electrode, these electrodes that we attached already in this guy, this electrical force is picked up by those electrodes from outer surface of the body, and then it goes through the ECG machine, through this wire which is connected to the electrode. After receiving of electrical impulse by electrode, this electrical impulse through this wire goes to the ECG machine. And then the ECG machine, this electrical force or electrical voltage or electrical impulse lead to deflection of this needle. This is the needle. The needle, or in some people they use stylus.
Yes.
Lead to deflection of the stylus of needle ECG machine over the ECG paper and produce PQRST. Remember, you should memorize PQRST and slightly a little bit. You should force a little bit above the U. U is also in some cases important, but the PQRST should not be forgotten. So my lecture will be started from this part up to first our lecture produce this PQRSTU. That is why I draw this simple diagram of the heart. And finally, our lecture will be finished by this ECG pattern. This is a typical ECG pattern. Did you catch? It's
Yes,
a little
yes.
bit tough. Initiation of the ECG is a little bit tough. Again, ECG for the beginner, part 1, basics and principle of the ECG. Electrocardiogram. In today's lecture, we'll be discussing about the electrocardiogram for short ECG or EKG. We'll be discussing about these two acronyms, ECG, EKG a little bit later, and I will tell you where they come from and what they stand for. In addition to this topic, electrocardiogram, I want to draw a simple picture or simple diagram of the heart. That is why I draw this simple picture of the heart. Because of two reasons I draw this simple picture of the heart. Reason number 1, due to electrical activity of this heart, electrical force, electrical potential, electrical voltage, electromagnetic force are produced. Remember, all of these terms are the same. Our mean electrical force. Then this electrical force should be presented by a vector. It must be presented by a vector because in physics, every force is presented by a vector. Then this electrical force moves from outside the chest to the outer surface of the body. And then this electrical impulse picks up by those electrodes which are attached to the body surface. After receiving of the electrical impulse, the electrodes, then they transmit through this part to the needle of the ECG machine. And then this electrical force leads to deflection of the needle of the ECG machine and produces different wave segment and interval, which is called ECG. Reason number 2, our course will be started from definition of the ECG and finally will be finished by this pattern, PQRST U wave. This was about the topic. Then, in addition of this topic, I mean electrocardiogram, this simple picture or simple diagram of the heart. In today's lecture, we will be discussing these matters. I want to write these matters in the right side of the board. Number 1, what is ECG? How should I define ECG? First of all, we should start from definition because everything should be started from definition. So I also start from definition. The second thing that we discuss in today's lecture, differences between ECG or ECG, electrocardiograph, and ECG graph. First, I think you are familiar with the definition of the ECG. Different book, different definition has given for the ECG. Number 1 definition and very simple definition for the ECG. ECG is recording of electrical activity of the heart over ECG paper. This is number 1. A little bit complicated. Number 2, when the ECG provides a graphic depiction of electrical forces which are generated within these heart. And then this electrical impulse or electrical force is presented by vector. Then this vector moves from outside the body to the outer surface of the body and picks up by those electrodes which are attached to the body surface and then transmit to the needle of the ECG machine and lead to deflection of the ECG, needle of the ECG, and produces different wave segment interval which is called ECG. Remember, each of these waves have got their own name. For example, first wave is called P wave, second wave is called Q wave, third wave is called R wave, fourth wave is called S wave, and fifth wave is called T wave. After the T wave, sometimes gives you a small wave which is called U wave. This is called E wave. Remember, all of these letters are English alphabet letters. They don't stand for anything. These are arbitrary English alphabet. They are arbitrary, and these are first P, second Q, third R, S. These letters, English alphabet letters, and they don't stand for anything, and they are arbitrarily English alphabet letters. This is definition number 1, a simple electrical activity of the heart over the ECG paper is recorded electrocardiogram. A little bit complicated definition, the electrocardiogram provides for us a graphic depiction of the electrical forces which are generated within myocardial cells. Then this electrical force moves from inside of the heart to the outside of the body surface. And by those electrodes which we are attached them already, this electrical force is received by electrode. Then we'll have a detailed discussion about the electrode. What is electrode? Now it is just enough to know about the electrode. Then this electrode pick up these electrical forces, and through this wire transmitted to this ECG machine, and then reach to the stylus of the ECG machine. And then due to this electrical force, the stylus of the ECG machine moves up and down and produces different wave segment interval, which is called a typical shape of the ECG. Each of wave have got their own name. First wave is P, second wave is Q, third wave is R, fourth wave is S, and the fifth wave is T, last one U wave. And finally, another definition for the ECG. When the electrical activity of the heart is graphically presented, this graphical presentation of electrical activity of the heart is also called ECG. So just the one short definition would be enough. Recording of electrical activity of the heart over ECG paper is called electrocardiogram. So ECG definition has got three main components. ECG definition is made from three components. Component number one, electrical activity of the heart. Electrical activity of the heart. Component two, recording of electrical activity of heart. Number three, ECG paper. During definition of the ECG, we should think about these three terms. Electrical activity of the heart, recording of electrical activity of the heart over ECG paper. Remember, when we are talking about the electrical activity of the heart, we should think about those ionic movements which occur across the cell membrane of these myocardial cells. Due to ionic movement or due to action potential, I will have a nice discussion about the action potential in my future lecture. Now just I want to become familiar with you by this term. Electrical activity. What is the electrical activity? When we are talking about the electrical activity of the heart, we should think about those ionic movements which occur across the cell membrane of myocardial cell and produces electrical voltage, electrical force, electromagnetic force, electrical impulse, electrical current, electrical discharge. Remember, all of these terms are the same. Just they are looking different, but they're giving one meaning, which is represented by electrical force. Now, this was about the electrical activity of the heart. I think electrical activity, when we study the electrical activity of the heart based on molecular level or based on the cellular level, this is called action potential. We have got a detailed discussion about the action potential. Just right now, take the name of these electrical activity. The first recording of electrical activity, ECG is made from three component definitions: electrical activity, recording of electrical activity, and ECG graph. This recording of electrical activity, it is related to the electrode. We will have a nice discussion about the electrode in my future lecture. Electrode. And finally, ECG paper. ECG paper, we also have a nice lecture about the ECG paper. So for definition of the ECG, a simple definition: recording of electrical activity of the heart over ECG paper is called ECG. Or in other words, the electrocardiogram provides a graphic depiction of the electrical forces which are generated within these myocardial cells. Then this electrical force moves from inside the heart to or inside of the chest to the outer surface of the body to the skin. And then these electrodes which are attached to the body surface, this electrical force moves toward the skin and received by these electrodes, and finally they transmit through this wire to the stylus or needle of the ECG machine and produce PT or STU wave. This is a typical pattern of the ECG. This was about definition. And also you should understand about the electrical voltage, electrical force, another electrical current, electrical discharge, electrical impulse. All of them are the same. They are giving the same concept or the same meaning, just they are looking different. This was about the ECG, or how should I define the ECG? Our ECG is made from three components. When you want to give a definition, you should use these three components. It will become simple for you guys. Electrical activity, the recording of electrode, and ECG. ECG. These three components are essential for definition of the ECG. Or a simple definition, when the electrical activity of the heart is graphically presented, this graphical presentation of the electrical activity of the heart is ECG. Yeah. So in short and simple, for the creation of the ECG, this following steps are essential. Creation. For creation of ECG, which step should be remembered or we should memorize for? First, electrical activity of the heart. When we are talking about the electrical activity of the heart, we should immediately think about the ionic movements. Due to ionic movement of this heart, ionic movements, step number 1, ionic movement. Ionic movement produce or electrical force. Step, electrical force. Ionic movement meaning electrical activity. Electrical activity meaning ionic movement. When you study the electrical activity of the heart based on molecular level or on cellular level, this is called action potential. In the ECG, we don't think about the single cell. We think about the whole myocardium. We record the electrical activity of whole myocardium from outer surface of the body, which is called ECG. Action potential is the studying of electrical activity of the heart based on molecular and cellular level. When we study the electrical activity of a single cell, this electrical activity which is studied in a single cell, this is called action potential. But when we study about the ECG, we think about the electrical activity of whole myocardium. This receiving of electrical activity from electrode produces typical ECG, which is called PQRSTU. You shouldn't forget this one. So the following state, we come back to following state. Ionic movement. This ionic movement, what is produced? Electrical force or an electrical potential. This electrical force is presented by a vector. It must be presented by a vector because in physics every force is presented by a vector. When we take the name of vector, you should immediately think about the electrical force. This electrical ionic movement produces electrical force. This electrical force should be presented by vector. We also have a nice lecture about the vector in my future lecture. This is called vector. When we are talking about the vector, we should think about the electrical force. Or when we are talking about the electrical force, we should think about the electrical vector, or vice versa. Vector. Then this vector or this electrical force is picked up by those electrodes which are attached to the body surface. This is electrode. Then this electrode transmits this electrical impulse through this wire to the stylus or to the ECG machine. And finally, you think this is ECG paper. And finally, this needle goes up and down, and then go up and down and produce typical ECG form, which is called a typical or a nice shape of the ECG, or even a QRS complex. It is made from fifth wave, which is represent one cardiac cycle. The first wave is called P wave. Then we are talking about the origin or the source of the P wave. For example, just I will tell you the P wave is represent atrial depolarization. We come to the second wave, Q wave. Q wave represents septal ventricular depolarization. And finally, this major wave. This is called R wave. This is represent QRS complex. After this, we have T wave. The T wave is represent ventricular repolarization. Sometimes after the T wave, we see a small wave, which is called U wave. So PQRSTU. We should you shouldn't forget about the PQRST. This was about the following step. First step, ionic movements. Due to ionic movements, electrical force generate. Electrical force should be presented by a vector, and this vector is picked up by electrodes. And electrodes transmit this electrical force to the needle or stylus of the ECG machine. This was about the component of the ECG. What is ECG? How should I define ECG? Differences between ECG, electrocardiography, and ECG graph. second matter is differences between electrocardiogram, and ECG graph. I think we have included this matter in our bedside discussions. And now again, we'll discuss about these three terms. ECG, there is no need to give another definition for the ECG. A simple definition, recording of electrical activity of the heart over ECG paper is called ECG. This is the concept of ECG. The second ECG, the second is electrocardiography. Those devices which are used for recording of electrical activity of the heart is called electrocardiography. For example, ECG machine, ETT, ambulatory ECG recording, especially 24-hour Holter monitoring, even recorder, another bedside monitoring, and finally even implantable loop recording. These are called electrocardiographs. Remember, electrocardiographs are used for those devices which are used for recording of electrical activity of our heart. A resting form of recording of electrical activity heart, the simple form, is resting ECG, or those ECGs that we take every day in our clinical practice, that is called resting ECG. And after resting ECG, we have got another ECG by name of ETT, exercise tolerance test, exercise ECG testing, and TDT, or treadmill or treadmill test.
TMT.
This is also form of the ECG. Resting ECG. Resting ECG. After resting ECG, we have got ETT or exercise ECG recording. Size ECG recording. ETT, exercise ECG recording, or TDT. These three terms give same concept. But especially since this ECG or this ECG is recorded over treadmill test, the another name is called TDT or exercise tolerance test. So we'll discuss about that a little bit later. TDT also is abbreviation that we use for ETT. This was about the electrocardiography. Electrocardiography represents those instruments which are used for recording of electrical activity of the heart. Another ECG, the ECG graph. This is a little bit tricky. The ECG graph. ECG graph. ECG graph is defined as a series of the waves. A series of the waves or deflection which are seen during one cardiac cycle. The ECG graph is defined as a series which are seen during one cardiac cycle. For example, P, Q, R, S, T. This is the first wave, P. The second wave, Q. The third wave, R. And the fourth wave, S. And the last wave, the fifth, T. And the U wave. Those waves are deflection. For example, this is deflected here and this. Those waves and deflection which are seen during one cardiac cycle, it is called ECG graph. ECG graph representation of one cardiac cycle, P, Q or S, T. A series of the wave or deflection are called ECG, is called ECG graph, which represent one cardiac cycle. What is one cardiac cycle? A rhythmic repetition of the systole and diastole is called cardiac cycle. This is a typical form of one cardiac cycle. One cardiac cycle is made of systole and diastole. From here, just the PVF represent depolarization, just like from here to here represent atrial systole, and from here to here represent ventricular systole. Then we will have a nice discussion about the correlation or relationship of the ECG to electrical element, ECG to mechanical event. We have discussed this in our future lecture. This is represent one cardiac cycle, which is made from systole and diastole. Remember, we should not forget, for systole and diastole, we also use some other electromechanical terms. When we are taking the name of these electromechanical terms, it also represents systole. For example, first we will be discussing about those terms which represent systole, those electrical terms. Electrical term. For example, electrical term, for systole we use activation. When we are talking about the activation, you should think about the systole. The second, excitation. Excitation, a definition for excitation, depolarization. And those tissues which are present in our body and they produce electrical activity, these cells are also called excited cell. For example, the nice example is cardiac, the second nervous, and the third one endocrine gland. These are produce electrical force. This was about the excited. So the second thing that we use for systole, electrical excitation, and the third one is depolarization. And those mechanical terms that were used for systole, those mechanical terms that we use for systole. Number one, contraction. Good. Contraction. Number two, shortening. Is it shortening? Number three, emptying. Now, as I mentioned before, when we are talking about the electrical activation, you should think about the systole. When somebody talk about the excitation, you should also think about systole. And finally, when somebody talk about the depolarization, you should think about systole. Now we'll be discussing about those electromechanical terms which represent diastole. Number one, recovery.
Relaxation.
Good. For excitation, they also, opposite of excitation, we have got again recovery.
Deactivation.
Opposite of depolarization, there is no doubt we have repolarization. We will be discussing about the depolarization. Depolarization when we are talking about the basics and fundamental of the ECG, or when we study the electrical activity heart based on molecular level, we will be discussing about the depolarization and repolarization. And those mechanical terms which represent diastole. Number one, here we have contraction. Here should have got relaxation. Here for our shortening, lengthening. Lengthening. When we are talking about the emptying, we should think about the filling. So when we study these books and they say activation, you should think about the systole. And when they should think about the excitation, you should also think about the systole. And those electromechanical terms which represented diastole, this was explained in this paper. This was our which topic? Difference between ECG, EEG, electrocardiograph, and ECG graph. ECG graph. How should I define the ECG graph? ECG graph is defined as a series. Series is a condition for definition of the ECG graph. A series of the waves and deflection which are seen during one cardiac cycle. One cardiac cycle, PQ or STU wave. This is one cardiac cycle. What is cardiac cycle? Cardiac cycle is a rhythmic repetition of systole and diastole. This is called one cardiac cycle. This is one cardiac cycle, or a series of the wave, and deflection of the needle. They produce one cardiac cycle. One cardiac cycle in the ECG is shown by this pattern. When we are talking mechanically, we should think about the activation. Or when we are talking about the mechanically, we should think about the contraction. This was about the definition of cardiac cycle and those electromechanical terms which represent systole and diastole. Now the differences between again ECG, EEG, EKG, resting ECG, resting ETT, and ambulatory ECG recording. We will discuss about these matters. Huh? Another topic, differences between ECG, the second, ECG, EEG, EKG, ECG, EEG, EKG. The third one, resting ECG or routine ECG, ETT, exercise tolerance test or treatment test, and finally ambulatory ECG recording. There is no need to give definition for the ECG or electrocardiogram. Again, recording of electrical activity of the heart or ECG paper is called ECG. What is the EEG? EEG, recording of electrical activity of brain tissue over EEG paper. Not ECG paper, EEG paper. Recording of electrical activity of the brain over EEG paper is called EEG. The first E stands for electro, the second E stands encephalon, and the third one gram meaning recording. That is why we discuss this matter. I will tell you a little bit later. Huh? We have got EKG. EKG also represents recording of electrical activity of the heart over ECG paper. Remember, there is no difference between ECG and EKG. Both of them represent electrical activity of the heart over ECG paper. But there are some countries, they prefer to use EKG rather than ECG. Because sometimes this EEG could be confused with this ECG because of the similar sound or same pronunciation or same sound. To prevent this confusion, some countries prefer to use EKG. That is why I discuss this EEG here. EKG, recording of electrical activity of the heart over ECG paper, is called ECG. EKG and ECG, both of them, they're same, but they are looking different. This EKG is a German word, or the root of this EKG we reach up to Greek. And this ECG is English word. English, recording of electrical activity over ECG, recording of electrical activity of brain tissue over ECG, and recording of electrical activity of the heart, again represent EKG. There is no difference between ECG and EKG. There is no, just they are looking different. But that is why we prefer to use EKG, because sometimes this EEG, because of the same sound, same pronunciation, could be confused with ECG. To prevent this confusion, some countries, especially USA, prefer to use EKG. This was about the difference. Resting ECG. What is resting ECG? I think you are familiar with resting ECG. Resting ECG or routine ECG. Resting ECG is an ECG that we should not ask the patient to exercise during taking of the ECG. This ECG, in contrast to ETT, does not need any special situation or simple condition, because this is resting ECG. Resting ECG is an ECG that we ask the patient, that we don't ask the patient to exercise during taking of the ECG. Remember, all those ECGs that we take in our clinical practice, inside of the hospital, outside our private clinic, this is called resting ECG. This has no any contraindication. This was about the resting ECG or routine ECG. What is ETT? Or exercise tolerance test. Tolerance test. Or exercise tolerance test. Other name, exercise ECG testing. ECG testing. Or TD or treadmill test. Treadmill test. Now we'll be discussing about the resting ECG. I have already discussed resting ECG is an ECG that we do not ask the patient to exercise during taking of this ECG. All those ECGs that we take in our clinical practice, that is resting ECG. What is exercise tolerance test? This is a test that we ask the patient to exercise over treadmill treadmill. It means we do two things at the same time. One, exercise. During exercise, we want to record electrical activity of the patient during exercise. Exercise tolerance test is a test that we ask the patient to exercise over treadmill. That is why somebody or some physician use treadmill test. Treadmill test or TDT. This exercise tolerance test provides valuable information about the ischemic heart disease or exercise-related arrhythmia. This is for IHD and exercise-related arrhythmia. IHD and exercise-related arrhythmia. This test need opposite of ECG test. Need a special situation and a special condition. It is not simple test because this test also have some risks. For example, a morbidity of 2 in 10,000 people have got this ETT test. They may develop morbidity 2 in 10,000 people, and a mortality 1 in 10,000. So this ETT is quite different from ECG, resting ECG. This test should be performed under the special situation. What would be our special situation? As I mentioned, this is a test that should be performed, this test over the treadmill. This is why this is called treadmill test. In fact, we do things at the same time, exercise, and during exercise, we record electrical activity, heart of the patient which do exercise over treadmill. This was number 2, treadmill test. What is the nice indication is? Chest pain. For differential diagnosis of chest pain, for example, cardiac pain from lung pains and cardiac pain from the thigh disease and costochondritis from gastrointestinal problem, for example, cholecystitis, pancreatitis, and other things. And finally, this test for differential diagnosis of chest pain, and 2 nice indication has got one diagnosis of IHD, and the second one exercise-related arrhythmia. This is, as I mentioned before, this test needs special situation and condition. This situation and the special condition of this test depend upon the special room. During taking of this CTT test, we should have 2 people, they have got experience for the close monitoring of CP for cardiopulmonary resuscitation. So in contrast of the routine ECG, ETT is not a simple test. It needs special situation condition. One of the special situation of condition, this patient during taking of this ETT test, 2 people were necessary to monitor CPR of the patient. They must be present over there. The second, in addition of these 2 people, there are some drugs and some equipment which are necessary for CPR. This test is performed based on Bruce protocol. Bruce protocol. Bruce protocol or modified Bruce protocol. We will have a detailed discussion about the ETT in my future lecture. Just right now, we take the name of this test. This is also ECG, but it is not simple ECG. This is a little bit complicated. During performing of this test, we should be cautious about some critical condition which occurred during this test. For example, 2 morbidity in 10,000, 1 mortality in 10,000. This was about the complication of this test, ETT heredity. As I mentioned before, this test is performed by Bruce protocol. And this test finally will be finished or ended by one out of these 4 reports. Number 1, this test is positive for angina and negative for ID or ischemia. Number 2, this test is positive for ID, ischemia, and negative for angina. Number 3, this test positive for angina as well as ischemia. Finally, this test will be used for positive will be by reversible ischemic heart disease. This test is called Bruce protocol, Bruce or modified Bruce protocol. When this test is ended, we should give a report for the patient. In this report, one out of these four should be written in your end of report. This needs a long lecture. We'll discuss about this in the future. We'll discuss about it. Another? Ambulatory ECG. Ambulatory ECG recording. ECG recording. As we know, ECG has a key role in the diagnosis of arrhythmia. Or ECG is essential for arrhythmia. ECG is essential for arrhythmia. But there are some patients, sometimes they may develop arrhythmia, sometimes they may not develop arrhythmia. This type of arrhythmia is called intermittent arrhythmia. Intermittent arrhythmia. Between 2 episodes of arrhythmia, intermittent arrhythmia, the 12 ECG lead is entirely normal. 12 ECG leads entirely normal. Those people who have got intermittent arrhythmia, sometimes the attack comes and sometimes it is off. This type of arrhythmia is called intermittent arrhythmia. What should we do to at least we record this intermittent arrhythmia? Between one condition. Between 2 episodes, 2 attacks of intermittent arrhythmia, the 12 ECG lead may be quite normal. So for this reason, we should achieve another methods or another alternative to record intermittent recording. One of them is called Holter monitoring or 24 hours ECG monitor. This was number 1. Number 2, ECG on event. ECG on event, for example, you have got intermittent arrhythmia and then they check 12 lead ECG. The 12 lead ECG normal. You will advise for the patient or you give a paper. When you have got some attack, you should take this paper and go to those clinics which are very near to you, and during attack they maybe record the electrical activity of this patient. This is called ECG and MN. This is also a variant of ambulatory ECG recording. Holter monitoring, ECG and MN. ECG on demand. ECG on demand. Number 4, bedside monitoring. Not 24-hour, bedside monitoring. And finally, implantable loop recording. These 4 variants are used for those people who have got intermittent arrhythmia. So again, intermittent arrhythmia. ECG has a key point or a key role in the diagnosis of those people who have got arrhythmia. But sometimes you are facing to some patient that they suffer from arrhythmia, but when you take the ECG of that patient, you will not record any abnormality during the ECG, especially from the standpoint of arrhythmia. Those people, sometimes they develop arrhythmia, sometimes they may not develop. It's called intermittent arrhythmia. The two conditions should be very important during discussion of intermittent arrhythmia. Number one, the 12 ECG lead maybe between two attacks is quite normal. In addition to that, we should use another alternatives to at least record the electrical activity of those people who have got intermittent arrhythmia. Number one, 24-hour ECG recordings or Holter monitoring. Number two, ECG on demand. Number three, ECG on demand. Number four, ECG bedside. And finally, implantable loop recording. This also need a detailed discussion. Inshallah, we'll discuss each of them in our next or future lecture. Another, I think EEG, we have already discussed EKG and EEG. What is ECG? What is EKG? There is no difference, yeah. Because this is electrocardio. Remember, when we use EKG, this C should be omitted, and instead of this C, we should use K, electro. And except of this yes, instead of this, we use electrocardiogram. Gram meaning recording. Huh? This was the difference between these two. I think today is enough. The next day we will again discuss about the ECG from basics and fundamental of the ECG.